Hey there, this is Dr. Paul Firnhaber. It's Wednesday and time for 10 Minutes of Truth. Now, as most of you know, we've been going through the book, The Lies I Taught in Medical School by Robert Lufkin, who's a medical school professor at USC and UCLA. And so today we're going to look at chapters 9 and 10, The Alzheimer's Lie and the Mental Health Lie. So here's the Alzheimer's lie that he believed and that he taught. Alzheimer's disease is a progressive, untreatable disease caused by beta amyloid accumulation. Now we know that when he talks about beta amyloid accumulation, those are the plaques that start showing up in the brain. And basically what he's saying is those plaques, the showing up of those plaques is a cause of Alzheimer's. There's really not a lot you can do about it. Well, he completely destroys that argument in this chapter, and I'm glad he does. And so we're going to talk, I'm just going to read some things out of the book about what he says about the beta amyloid plaques. He says, if beta amyloid plaques actually cause Alzheimer's, the number of plaques would correspond to the severity of the symptoms. However, a study by the National Institute of Health examined the brains of 97 people who did not have dementia or cognitive impairment. It was found that 40% of these patients had amyloid plaques and 20% met the Alzheimer's diagnostic criteria because of these plaques. Yet they did not suffer lapses in memory typical of Alzheimer's patients. Complicating things further is a study that finds the brain degeneration typical of Alzheimer's can occur without any amyloid plaques. Finally, there are even reports of actual fraud in the reporting of amyloid research. Scientists recently found apparently falsified images in numerous publications, including a landmark 2006 paper in the journal Nature linking amyloid beta protein to Alzheimer's dementia. So what does cause Alzheimer's then? And really the question is what is the cause of these plaques? Now, I've read papers and books that say that the plaques are a defense mechanism in the body to problems in the brain. They actually protect the brain rather than cause Alzheimer's. But Dr. Lufkin talks about some alternative truth theories and harsh truths regarding Alzheimer's. One underlooked cause is mercury toxicity from seafood. Mercury is known to cause cognitive impairment. Another known cause of cognitive impairment is lead toxicity. Mold toxicity is another one. Pesticides can have a bad effect on brain health. Another possible source of trouble is infections and inflammation. When done right, inflammation removes harmful stimuli from the body, but it can damage surrounding tissue. So infections like herpes virus, cytomegalovirus, CMV, as well as hepatitis C have also been linked to dementia. Even bacteria that infect teeth and gums and cause gingivitis has been linked to Alzheimer's. Another possible cause of Alzheimer's is head trauma or traumatic brain injury. And we see this a lot in like football players and soccer players. Finally, poor air quality can impact cognitive function. A 2016 Canadian study has reported a link between dementia and living close to busy roads. Now, what about the metabolic connection to Alzheimer's? Like so many of the other diseases discussed in this book, metabolic problems in Alzheimer's share a strong yet little known correlation. Brain glucose dysregulation or blood sugar dysregulation has been demonstrated in Alzheimer's patients. Another factor is mitochondrial dysfunction. He says, while few mechanisms behind Alzheimer's are fully understood, mitochondrial dysfunction appears to be a critical factor. Other factors include depression, obesity, cardiovascular disease, lack of exercise, and poor sleep. A study in the Yansai Medical Journal indicate incidence of Alzheimer's are strongly correlated with diabetes, as patients with diabetes show the same insulin resistance in the brain that is present elsewhere. Likewise, a 2007 study has found a high correlation of metabolic syndrome and Alzheimer's. So it looks like there could be a lot of causes for Alzheimer's, and these are things that need to be checked out, if you have an Alzheimer's patient. And, of course, one of the things that's really necessary is a very thorough case history to find out what may be the issue. So there are causes. These are researched, and he quotes that research here. And those are some of the things that really need to be looked at. So the second lie that we're going to be talking about today is called the mental health lie. And here's the lie. Metabolism has little effect on mental health. And he just completely destroys this argument. First of all, he talks about the current model of mental health. And one of those models, a pretty significant one, is the chemical imbalance of the brain model. And here's what he says about it. He's absolutely right. He says, there is not and could never have been a scientific chemical imbalance theory of mental illness. Such a theory would require a set of interlinked hypotheses, all supported by rigorous studies to be integrated into a coherent whole. These hypotheses do not exist because clinical studies are limited and findings are inconclusive. Without useful hypotheses that explain the mechanism of mental illness, there is no theory. So basically what he says is his theory of chemical imbalance just doesn't add up. And there's no way to do studies on it. You can't, how do you do studies on brain imbalances in the brain in mentally ill patients without, drilling into their brain and taking samples? And that would be considered unethical. So this whole theory of, there's a chemical imbalance of the brain is just not proven at all. So what he says then is that mental illness is really a downstream problem from metabolic issues going on in the body, which I completely agree with. He talks about major depressive disorder, bipolar disorder, and schizophrenia are all associated with increased rates of obesity. Obese individuals are more likely to have mood disorders than those of a healthy weight. Obesity worsens the course of bipolar disorder and impairs cognition. Obese people are 25% more likely to have a mood or anxiety disorder. Diets high in junk food lead to higher rates of obesity and depression. Why is this so? Individuals with higher body mass index exhibit alterations in brain circuit connectivity, causing disturbances in mood and cognition. Patients diagnosed with depression are 60% more likely to develop diabetes than the general population. People who present with new onset schizophrenia often have glucose dysregulation as well, even if they don't even meet the criteria for diabetes. 50% of bipolar patients have impaired glucose metabolism. Brain imaging shows a similar, although milder, decrease in brain glucose utilization in bipolar disorder compared to Alzheimer's. People with schizophrenia and bipolar disorder are much more likely to have cardiovascular disease than the general population. Finally, he talks about things that really work well. And he spends a lot of time on the ketogenic diet. And he says if you could take these patients, these bipolar disorder patients, schizophrenia patients, depression patients, and get them on a ketogenic diet, a high-fat, extremely low carbohydrate, moderate protein diet, and get them to stay on it, research has shown that this can really produce very, very good results. Now, one other thing that he brings up, which I thought was quite interesting, is sugary soda consumption and the incidence of violence. He says the University of Vermont economics professor Sarah Solnick and David Hemingway of the Harvard School of Public Health explored the possible relationship between soda consumption and violence. And adolescents who drank more than 5 cans of soft drinks per week, which is about 30% of their sample, were significantly more likely to have carried a weapon and to have been violent with peers, family members, and dates. Frequent soft drink consumption was associated with a 9% to 15% point increase in the probability of engaging in aggressive actions, even after controlling for gender, age, race, body mass index, typical sleep patterns, tobacco use, alcohol use, and even things like having family dinners. So what does that tell us? That tells us that what we eat and our metabolic function has a very significant state on our mental health. And, when people come into me and they have these issues, I always try and look for underlying causes, things like blood sugar dysregulation, things like chronic high levels of inflammation, things like infections, things like nutrient imbalances or nutrient deficiencies. And of course, I look at what people are eating. And so this is all really important for people to understand. And if you know people have family members or friends who have these issues, there is help for those people. And just changing their diet may make an enormous difference in their mental state and their quality of life. And he certainly believes that in his chapter called The Mental Health Lie. So I would encourage all of you who listen to me to eat healthy diets, low sugar, high fat, low sugar, and moderate protein diets, which is what I generally try to consume, and get plenty of extra nutrients in the forms of good whole food vitamin supplements, plenty of exercise, and a lot of times the metabolic problems that you may be experiencing may go away. And we treat a lot of those problems here at the office, and we do comprehensive blood panels and other specialized tests to determine, why people are ill. What is the underlying cause of a person's illness or a person's symptoms? There's a cause for everything. There's nothing that happens without a cause. And so that's what we look for here at Lincoln Disc and Nutrition. That's part of our functional medicine, part of our practice. So that's all I have for today. If you're interested in the services that we offer here, our number is 402-488-2220, and our clinic address is 4535 Normal Boulevard, Suite 105 here in Lincoln, Nebraska. So I will see you next week, and I'll have another 10 minutes of truth. See you then.